discussion includes sensitive features. So now I'm going to discuss about sexually transmitted disease. The term sexually transmitted disease or STD is used to refer to a condition passed from one person to another through sexual contact. So STDs are passed from one person to another through sexual activity, including the vaginal, oral, and anal sex. But sometimes they can spread through other intimate physical contact. This is because some STDs like herpes and HPV or human papillomavirus are spread by skin-to-skin contact. Okay, so an STD may also be called sexually transmitted infection or venereal disease. So, STD or sexually transmitted disease can be also called sexually transmitted infection or venereal disease. These are the disease that is transmitted by sexual contact caused by microorganisms that survive on the skin or mucous membranes, or that are transmitted via semen, vaginal secretions, or blood during intercourse. Note that it doesn't mean sex is the only way STDs are transmitted, depending on the specific STD. Infections may also be transmitted through sharing needles and breastfeeding. If you are diagnosed with an STD, know that all can be treated with medicine and some can be cured entirely. So STDs are preventable. If you have sex, know how to protect yourself and your sexual partner from STDs. STDs can be caused by bacteria, viruses, and parasites. So who is affected by sexually transmitted disease? Most STDs affect both men and a woman, but in many cases, the health problems they cause can be more severe for women. If a pregnant woman has an STD, it can cause serious health problems for the baby. So now let's proceed to the symptoms of STDs in men. So it is possible to contract an STD without developing symptoms, but some STDs cause obvious symptoms. In men, common symptoms include the following: pain or discomfort during sex or urination, sores, bumps, or rashes on or around the penis, testicles, anus, buttocks, thighs, or mouth, unusual discharge or bleeding from the penis, painful or swollen testicles. So, understanding the risks and knowing the signs and symptoms of common STIs in men and people with a penis is crucial for anyone who is sexually active. So, let's proceed to the symptoms of STDs in women. In many cases, STDs don't cause noticeable symptoms. When they do, common STD symptoms in women include the following: pain or discomfort during sex or urination, sores, bumps, or rashes on or around the vagina, anus, buttocks, thighs, or mouth, unusual discharge or bleeding from the vagina, so itchiness in or around the vagina. So the specific symptoms can vary from one STD to another. So many different types of infections can be transmitted sexually. The most common STDs are to be discussed in this video. So my question is, what is chlamydia? So chlamydia is a common sexually transmitted disease, and a certain type of bacteria causes chlamydia, and it caused by bacteria called Chlamydia trachomatis. It can infect both men and women. So women can get chlamydia in the cervix, rectum, or throat, and men can get chlamydia inside the urethra, rectum, or throat. So many people with chlamydia have no noticeable symptoms. When symptoms do develop, they often include the following. So pain or discomfort during sex or urination, green or yellow discharge from the penis or vagina, pain in the lower abdomen. So if left untreated, okay, chlamydia can lead to infections of urethra, prostate gland, or testicles. Magkakaroon din siya ng pelvic inflammatory disease and also infertility. So what if a pregnant woman has untreated chlamydia? Can she pass it to her baby during childbirth? Yes. So if a pregnant woman has untreated chlamydia, she can pass it to her baby during childbirth. And the baby may develop pneumonia, eye infections, and blindness. So you can get chlamydia during oral, vaginal, or anal sex with someone who has infection. So a woman can also pass chlamydia to her baby during childbirth. So if you have a chlamydia in the past and were treated, okay, you can get reinfected if you have unprotected sex with someone who has it. Okay? Chlamydia is more common in young people, especially in young women. So you are more likely to get it if you don't consistently use a condom. So if you have a multiple partners. So note that chlamydia is a common sexually transmitted disease that can be easily cured. If left untreated, chlamydia can make it difficult for a woman to get pregnant. So antibiotics can easily treat chlamydia. Okay, so now let's proceed to HPV or human papillomavirus. So HPV is a virus that can be passed from one person to another through intimate skin-to-skin or sexual contact. There are many different strains of the virus. Some are more dangerous than to others. HPV is the most commonly sexually transmitted infection. It is different virus than HIV and HSV, or also known as the herpes. Okay? So HPV is a deadly virus that is known to cause cancer. It is sexually transmitted, and the first signs may involve eruption of warts in a different body part. So how is HPV spread? So you can get HPV by having vaginal, anal, or oral sex with someone who has the virus. So it is most commonly spread during vaginal or anal sex. So HPV can be passed even when an infected person has no signs or symptoms. So anyone who is sexually active can get the HPV even if you have sex with only one person. So you also can develop symptoms years after you have sex with someone who is infected. So this makes it hard to know when you first became infected. Hindi mo malalaman kung sino or kanino ka infected. Okay? Kasi nga, yung symptoms, it may develop years after you have sex. Okay, so does HPV cause health problems? In most cases, HPV goes away on its own and does not cause any health problems. But when HPV does not go away, it can cause health problems like genital warts and cancer. So when you say genital warts, it usually appear as a small bump or group of bumps in a genital area. So they can be small or large or raised or flat or shaped like a cauliflower. Okay, so makikita nyo mamaya yung picture. HPV can cause cervical and other cancers, including cancer of vulva, vagina, penis, or anus. So here are the most common symptoms of HPV is warts on the genitals, mouth, or throat. Okay, some strains of HPV infection can lead to cancer, including oral, cervical, vulval, penile, and rectal cancer. Okay, so ito yung example ng oral cancer. The symptoms of oral cancers are the lump in your mouth or lips, okay, sore mouth or throat, mild to high fever that keeps recurring, okay, bleeding from your gums or other parts in your mouth, difficulties in swallowing food, drastic weight loss, pain in either both of the ears, stiff and sore jaw, visible white patches in the mouth, and also a hoarse voice. Okay? So this is an example of cervical cancer. It is a type of cancer that occurs in the cells of the cervix and the lower part of the uterus that connects to the vagina. So early stage cervical cancers generally produces no signs or symptoms. So signs and symptoms of more advanced cervical cancer include the vaginal bleeding after intercourse, between periods or after menopause. Watery bloody vaginal discharge may be heavy or have a foul odor. So pelvic pain or pain during intercourse. So this is also example of vulvar cancer. If you want to see a realistic picture, go to Google. And also penile cancer. So this is the example. Okay, so you can do several things to lower your chances of getting HPV. First is to get vaccinated. The HPV vaccine is safe and effective. It can protect against diseases including cancers caused by HPV when given in the recommended age groups. So if you are sexually active, use latex condoms the right away or every time you have sex. This can lower your chances of getting HPV, but HPV can infect areas not covered by condom. So condoms may not fully protect against getting HPV. So be in mutually monogamous relationship. Dapat isang partner lang. So there are tests that can be used to screen for cervical cancer. These tests only recommended for screening in women aged 30 years and older. So HPV tests are not recommended to screen in men, adolescents, or women under the age of 30 years. So most people with HPV do not know they are infected and never develop symptoms of health problems from it. So some people find out they have HPV when they get genital warts. So women may find out they have HPV when they get an abnormal pap test result. When we say pap test, it is a method of cervical screening used to detect potentially precancerous and cancerous processes in the cervix or in the colon. So can I be treated for HPV or health problems caused by HPV? Yes. So genital warts can be treated by your healthcare provider or with prescription medication. If left untreated, genital warts may go away and stay the same or grow in size or in number. So these are the common example of genital warts. So cervical cancer. Cervical cancer, pre-cancer can be treated. Women who get routine pap tests and follow up as needed can identify problems before cancer develops. So prevention is always better than treatment. So other HPV-related cancers are also more treatable when diagnosed and treated early. And now let's proceed to syphilis. The first symptom to appear is a small round sore known as chancre. It can develop on your genitals, anus, or mouth. It is painless but very infectious. Later symptoms of syphilis can include the following: rash, fatigue, fever, headaches, joint pain, weight loss, and hair loss. And if left untreated, late-stage syphilis can lead to loss of vision, loss of hearing, loss of memory, mental illness, infections of the brain or spinal cord, heart disease, and also death. Okay? Human immunodeficiency virus. I know that you are all aware on this, yung HIV. Okay? So, it can damage the immune system and raise the risk of contracting other viruses or other bacteria and certain cancers. So, if left untreated, okay, it can lead to stage 3. Ito yung pinakamalala, yung AIDS na tinatawag natin. Okay, so, kasi ang virus, okay, it attacks the body's immune system. Pinapahina niya ang body's immune system mo kapag nagkaroon ka ng HIV. So, if HIV is not treated, it can include to AIDS, okay? Acquired immunodeficiency syndrome. Okay? So, pag sinabi nating acquired immunodeficiency syndrome, it is a chronic, potentially life-threatening condition caused by a human immunodeficiency virus by damaging your immune system. So, HIV interferes with your body's ability to fight infection and diseases. So, ang HIV, it is a sexually transmitted infection. It can also be spread by contact with infected with the blood or from mother to child during pregnancy, childbirth, okay, breastfeeding, and etc. Okay, so without medication, it may take years before HIV weakens your immune system to the point that you have AIDS. Okay, so there is no cure for HIV or AIDS, but medications can dramatically slow the progression of the disease. So these drugs have reduced AIDS deaths in many developed nations. So HIV isn't spread through the air, water, or insect bites. Okay, yun ang tatandaan nyo. HIV isn't spread through the air, through the water, or insect bites. But in the early or acute stages, it's easy to mistake the symptoms of HIV with those of the flu. Diba? Kasi masyadong malapit. Okay, for example, the early symptoms can include the following. Okay, the fever, chills, aches and pains, swollen lymph nodes, sore throat, headache, nausea, okay, rashes. Okay, yan ang mga symptoms ng HIV. Gonorrhea. Okay, so gonorrhea is another common bacterial STD. It's also known as the clot. So many people with gonorrhea develop no symptoms, but when present, symptoms may include the following. So anyone who is sexually active can get gonorrhea. So gonorrhea can cause very serious complications when not treated, but it can be cured with the right medication. So how do people get gonorrhea? So gonorrhea is transmitted through sexual contact with the penis, vagina, mouth, or anus of an infected partner. So ejaculation does not have to occur for gonorrhea to be transmitted or acquired. Gonorrhea can also be spread perineally from mother to baby during childbirth. Okay, so people who have gonorrhea and receive treatment may be reinfected if you or they have sexual contact with a person infected with gonorrhea. Okay? So, ang crabs is another name for pubic lice. Okay? They are tiny insects that can take up residence on your pubic hair, like head lice, okay, and body lice. They feed on the human blood. Okay? So, trichomoniasis is also known as trich. It is caused by a tiny protozoan organism that can be passed from one person to another through genital contact. Okay, so trichomoniasis is a common sexually transmitted infection caused by a parasite. Okay, in women, trichomoniasis can cause a foul-smelling, foul-smelling vaginal discharge, genital itching, and also painful urination. Okay, so men who have trichomoniasis typically have no symptoms. Pregnant women who have trichomoniasis might be at higher risk of delivering their babies prematurely. Okay, to prevent reinfection with the organism that causes trichomoniasis, both partners should be treated. Okay, both partners should be treated. Okay, let's now proceed to herpes. Okay, herpes is the shortened name for the herpes simplex virus or HSV. there are two main strains of the virus, the HSV1 and the HSV2. Both can be transmitted sexually, and it is a very common STD. Okay, note that genital herpes is a common STD, and most people with genital herpes infection do not know they have it. Okay, ano nga ba yung HSV1 and HSV2? Okay, pag sinabi nating HSV1, okay, these are the primary causes oral herpes, which is responsible for cold sores. Okay, however, okay, yung HSV1 can also be passed from one person's mouth to another person's genital during oral sex. So when this happens, the HSV1 can cause genital herpes. Okay, doon na nagkakaroon ng genital herpes kasi nga doon sa oral sex. Okay, and yung HSV2, ito na yung primarily causes genital herpes. Okay, yun dito nga kung makikita nyo yung example. Yan. And the end. Okay, thank you very much for listening for this discussion, and I hope every one of you are aware on the different sexually transmitted disease. And here are, in order for us to avoid, to prevent these kinds of diseases, we should always know and we should always be aware on the different contraceptives.